Hi, I'm WYATT Sharp in Ottawa today with Civics Canada as part of their 2023 Student Budget Consultation. Over the course of today, we've been meeting with various members of Parliament from various political parties to discuss and share with them the results of the 2023 Student Budget Consultations as a way to hopefully not only have their insight and input, but also to have the voices of students and the results of this survey shared with them to hopefully implement some of them into the upcoming federal budget. Throughout the survey, students did point out, 3 out of 10 students pointed out that they believe it would be more difficult to take action on climate change should, the worst emitting countries not take equivalent action. So how can we compensate for, countries who are some of the highest polluters not necessarily taking very strong action?
Well, Canada actually needs to show leadership, and sadly, we haven't been. At the rate in which we're going, never mind what's happening with the other countries, we're not meeting our own targets. And so Canada needs to step up and take it seriously.
Unfortunately, what we're seeing right now with the current government is a real focus on tax plans rather than environment plans. So what our Conservative leader, Pierre Poilievre, has said very clearly is that we will get rid of the carbon tax and instead focusing on technology to achieve our commitments. Technology on improving the environment, making sure that we are leaving an environment and a country that our children and our future grandchildren can be proud of and to live in a wonderful place that we call Canada.
The values of this government are clearly aligned with what is happening in the world in terms of climate. So I feel very confident that if anyone, this government is the one to address climate change. We've got the players and the commitment and the willingness to act.
Well, it starts with being honest about the money that we could be reallocating to the climate solutions we need today. So this is the billions of dollars that the federal government continues to subsidize the oil and gas industry with. Those are the funds that could be directly used to fund the climate solutions, whether it's public transit, renovating and doing deep energy retrofits across the country. But ultimately, it really comes down to being clear about the role that Canada has to play to do its fair share to tackle and to rise to the challenge of the climate crisis. And time and again, young people across the country, they're ahead of parliamentarians on this. They're calling for more, and it's on this federal government to step up.
Something that came up quite regularly over the course of this survey that students, over 2,000 of them from across the country, took was healthcare, more specifically access to prescription drugs. What can the federal government do to ensure access to those types of things to improve, the lives of people?
Yeah, it's a good question because when you have shared responsibility, it's always tricky. But I think one thing the government does is provide leadership, direction in terms of what's important. And of course, the Canada Health Act is federal legislation, and the Canada Health transfers are set up through that. So most recently, the really historic $200 billion over the next 10 years, almost $200 billion, over the next 10 years, of both the normal Canada Health transfers, but also money set aside for these bilateral agreements with each province and territory.
We need to build more projects right here in Canada. What that will do is help produce more revenues for the government. What do those revenues do? They support social programs. We can support more infrastructure in this country. We can support healthcare in this country, education. We can support the provinces. We can support municipalities with that. We need to make sure, again, we need to get those gatekeepers out of the way so that we can support those social programs.
So access to prescription drugs, one of the issues that I often have advocated on the Hill is for ALS, which is a rare disease. I think we've committed in previous platforms a rare drug disease strategy. I think that sets up a good foundation to eventually move to eventually a pharmacare program. Some provinces offer youth free medication, some don't. Some private insurance, some have insurance, some don't. So working with provinces, obviously money has to be involved. We've signed a 10-year, we've signed a deal with provinces over 10 years to increase health transfers.